Good afternoon, everybody. Mondo Flores here with AFSCME Local 1624, coming to you from our respective houses, practicing safe and social distancing for many feet. Normally, we shoot these videos from within our office with Carol and I or anybody else who joins us. But now, due to the rise of COVID numbers, we've elected to Zoom from inside of respective houses, but still want to make sure that we still give you guys a message of what's going on, a weekly update. As well, wanted to wish everybody a safe and happy 4th of July. So without further ado, I'll introduce Carol. She has some information about what's been going on and just kind of stay up to date with everything that's going on. Carol.
Good afternoon. Carol Guthrie, Business Manager for AFSCME Local 1624. I hope you're all doing well. I know that COVID positive cases among city and county employees is on the rise. Obviously, we are very concerned about that. We have received numerous calls today and yesterday from the City of Austin Public Library. We know that there have been a number of employees who have tested positive for COVID, and what we have been able to ascertain from our members is that in some of these areas, the library has not been following the CDC guidelines, and the employees have not been practicing the social distancing. Our custodian staff are concerned that they haven't had proper training on infection control, that they haven't had proper training on making sure they have all of the right chemicals to be able to do the sanitization after someone tests positive. And more importantly, they are concerned for their lives. And one can't blame them. This is a very serious situation. And we want to make sure that all of these employees are safe and that the library will start communicating with their management team to make sure that people are practicing social distancing. If two people are riding in a vehicle and you are both in the front seat, that is not 6 feet, okay? So that would not be practicing social distancing. If you're in a meeting and you are sitting right next to somebody, again, that is not practicing social distancing. We have heard from different areas of the city of Austin as well as Travis County. We were trying to get a standardized protocol from Travis County. We still don't have that as we speak today, right now. So we are very concerned. The employees are concerned. Safety is our #1 concern. And these individuals who are having to go in and clean up after someone tests positive are the employees that then are testing positive themselves. So the question from all of us, including the workers and including this union, is why are we not contracting with a company that can come in and sanitize the way that the libraries need to be sanitized? I know we received millions of dollars through the CARES Act. I would assume that part of that money is to make sure that the city is operating safely. And if it wasn't part of that money, the city needs to find the money to have the library sanitized appropriately by a professional. In the libraries where people are doing the drop off of the books, we have been told that these books are not labeled, that they're in quarantine, so to speak, because they should be after they're collected for so many days. But again, they're not labeled that way, so the custodial staff doesn't know that. And this is creating many cases of COVID-19. Somebody needs to get a handle on this. This is a violation of their health and safety on the job that they are entitled to. And we are going to monitor this until we get someone to listen to us to make sure that every worker at the city, at the county, understands what the protocol is if their coworker tests positive for COVID. As we talk to you today, nobody knows what that protocol is. So we're just talking about simple communication, and we realize that most of the management or upper management, perhaps they're teleworking. I don't know, but they can still send out a memo. They can send it down the chain. We need to be able to communicate with the people closest to the bottom of the rung here. I know we had heard concerns from the lifeguards out at Barton Springs. They were concerned for their livelihood. I mean, we're asking people who are making $15 an hour to be the ones on the front line to make sure that everything is safe for the community. And I believe that the city of Austin should make sure that their own employees are treated just as well as these employees are treating the community. Because if one gets sick, so does another and another. And at this point, it's out of control. And I think our request is very reasonable. What is the protocol? Who do they call? Who do they tell? How do they know if they need to have a test, don't need to have a test? I have another employee, went to take the test. They want that person to come back to work before they get the test results back. So if those test results are positive, that person has been on the job working. These are the same concerns that Dr. Ascott has been stating to the council, to the commissioners, only they're talking about the community. Well, these are city and county workers. They are under the control of people who are making these policy decisions. You all, as elected officials, can direct your staff to make sure there is a protocol, that every worker knows what that protocol is, and that every worker has their safety equipment, the proper PPE, that they have been trained on how to sanitize to protect themselves as well as the public. So we want to continue to hear from all of you. Our number, and I think y'all must have it because that phone has been really pretty busy yesterday and today. And we are on this, but our number is 512-477-5545, or email us at info@afscme1624.org. We want to know and hear what is going on in your workplace so we can bring relief, so that you will feel safe, so that you can continue to do your job. So again, 512-477-5545. Please call us. Let us know. We're going to get you the things that you need so that you will be safe. Please have a safe and blessed holiday. Thank you so much.